Hi, my name is Jennifer Borowczak. I'm a senior here at Eastern Illinois, and I am a psychology and preoccupational therapy major. Today I will today I will be speaking about eating disorders, including anorexia nervosa, bulimia nervosa, and also obesity. Anorexia nervosa can be defined as reducing one's food intake and the fear of becoming overweight, even though already underweight and thin. It is a dangerous disorder that can cause one to refuse to maintain average or normal weight depending on his or her age. Also, anorexia can be described as those with anorexia are often characterized as perfectionists and overachievers who appear to be in control. In reality, they suffer from low self-esteem and confidence and overly criticize themselves. They are also very concerned about pleasing others, according to Matthews. Switching over to bulimia nervosa, which is similar in a form of anorexia, occurs when a person eats a meal and then vomits to not gain the weight. The taste of the food can be satisfying to that person, but the vomiting occurs afterwards to keep the weight off. Bulimia can be defined as individuals follow a routine of secretive, uncontrolled, or binge eating, ingesting an abnormally large amount of food within a set period, followed by behaviors to rid the body of food consumed, which was also according to Matthews. Bulimia usually involves vomiting, which is the most common form, laxative pills, diet pills, diuretics, fasting, and extreme exercising. According to Cassell and Blees, bulimics have no self-control while binging and can eat up to 20,000 calories in one day, or can eat for 1 1/4 hours non-stop. The exact cause is unknown, but it may be due to the malfunctioning parts of the brain, for it regulates mood and appetite. Switching over to obesity, which is what America is predominantly known for, considers more than half of Americans. It's not only linked to societal factors, but also biological factors. People who are obese are at risk for heart problems, type 2 diabetes, strokes, sleep apnea, and respiratory problems, specific cancers, high blood pressure, and lipid disorders, according to Cassell and Blees. Obesity is not only controlling body weight for the normal weight pertaining to his or her body. Treatment for eating disorders are also included, and when looking at bulimia, you can either have pharmacologic interventions and or psychotherapy. Anorexia's treatment is usually monitoring the system of patients' weight once or twice a week, counseling, but inpatient treatment is the most successful because having surveillance of a person who has anorexia is the most highest rate of success, and it's making sure that one doesn't transform into the bulimia stage and go and want to binge after eating. Obesity's treatment is calorie reduction, inclination of exercise, eating in moderation, and behavior moderation. Recovery is also going to be discussed right now, but it's important to know that treatment and recovery are very separate from each other. When it comes to recovery, one has to want recovery like any other addiction. It involves more than just the abandonment of starvation and stuffing. In conclusion, eating disorders can be very hazardous overall and can even lead to death. Not taking care of oneself is unhealthy, and a person is at risk for health issues. Anorexia, again, which is the lack of appetite and food intake, bulimia, which is binge eating then purging, and obesity, which is being excessively overweight, are all disorders that endanger the human body. Also, anorexics and bulimics are wrapped around the idea of body image and weight that they will engage in anything to accomplish the goals of being thin. Obesity is when one cannot control his or her eating habits, but fortunately there are treatments and recovery that exist for these disorders, including the support system from the family.